Good afternoon, everyone. I think people are still coming in from the waiting room, so we'll give it one more minute before we get started.
Hello, everybody.
Hi.
Hello. All right, I think we're going to go ahead and get started. Good afternoon again. My name is Emily Beauregard. I'm the Director of Kentucky Voices for Health, also a member of the Thrive Kentucky campaign. We still have a few people who are joining the webinar. I'm going to be just sharing a little bit of information before we get started with today's advocacy training. I want to thank everyone for taking the time to be with us today. This is a training that we have put on a number of times, and we find that it's one of those perennial trainings that you always learn something new from. So even if you've seen it before, I think you'll get something new out of it today. And we hope that it will give folks some new tools and skills for advocating. But before we go into the training today, I wanted to share a little bit of information about the Thrive Kentucky campaign for those of you who may not be familiar with our work. Thrive Kentucky is a group of partner organizations working together to pursue systemic change to meet the basic needs of all Kentuckians. And we do that through policy advocacy. So you can see our list of priorities here and our shared principles, I should say. And what we really do is take a health in all policies approach. We work so that we can make the right choice, the healthy choice, the easy choice. And we recognize that, our health isn't just affected by our healthcare system, it's affected by our economy. It's affected by the structures that we've put in place for our society. And a lot of different things affect our health. There are social determinants of health that really need to be addressed in order to make sure that everyone has the opportunity to be healthy. And so the work that we do is really focused on addressing those social determinants of health through policy advocacy, changing the way our policies and our system are structured so that we have a more equitable system for all Kentuckians. And as policy advocates, our job is to really fundamentally change the way that our safety net is viewed, the way that it's designed, and the way that it's funded by policymakers, which is why we're having this training today. This training is really an essential for anyone who wants to become a more effective advocate. It will help you to better understand how bills become laws and regulations, and how you can have an influence both in the development of these laws and also the implementation of policies on both the legislative and the regulatory side. And so today's training is going to be provided by the one and only Dr. Sheila Schuster, who I think many of you are probably familiar with. My guess is that many of you know her from various walks of life or parts of your career. If you don't know who Sheila is, after today, you certainly will remember her. She is a licensed child psychologist. She has more than 30 years of experience working as a mental health and disabilities advocate in Frankfort. She also happens to be the director of the Advocacy Action Network and the founding board chair for Kentucky Voices for Health. And we like to call her the godmother of advocacy in Kentucky because she's taught so many of us the ropes by now. And today she'll be sharing a lot of those lessons with you. So before we dive into today's training, I'm just going to do a little bit of housekeeping, and then I'm going to hand it off to Sheila. We have a lot of folks in our webinar today, so please be sure to mute yourself. If you have questions or if you have a comment that you want to make, you can do that in the chat box. I think that Sheila will be taking those questions and comments throughout the presentation, and so she'll be stopping and addressing those things as we go. We are recording this webinar, so we're going to be sending a link out to that recording after the webinar is over, probably sometime tomorrow. So you'll get that along with a copy of the slides and anything else that Sheila presents today. And I also wanted to mention that we are offering continuing education credits for licensed social workers and for certified community health workers. So if that's you and you'd like to get a certificate for attending today's training, you can email Angela Cooper. Angela, if you don't mind putting your email address in the chat box, Angela can help make sure that you get that certificate. And there was one other thing I wanted to mention. Thrive Kentucky has been having monthly policy updates. We do now, because we are in a pandemic, our policy updates have focused on COVID-19 state and federal policies, although we will share other updates as they happen. We try from month to month not to repeat the same information, but to really tell you what's changed within the past month, what we're anticipating as upcoming policy changes, and then give people information about how they can get involved, how they can take action as advocates. And so if you'd like to join our next policy update, that's going to be on August 4th at 2 p.m. We can also put a link to that registration in the chat box for you. And with that, I'm going to turn it over to Sheila to get things rolling.
Thank you so much, Emily. I appreciate that. Angela, if we could go to that first slide, please. So this is an interesting slide. It shows our Kentucky Capitol with 10,000 advocates. And if we were in a position where I could say to you, who do you think those folks are? You would look and think, well, what group has so many folks that they can get 10,000 people in front of the state capitol? And many of you, probably most of you, would guess that those are teachers. And you would be right. However, it was not in the last 2 years, but back in 2005 that we had this great onslaught of teachers at the Capitol when the Fletcher administration was threatening to cut funding to the public schools and so forth. And there was this huge turnout, very impressive in Frankfort to have 10,000 folks there. I might tell you that teachers have a secret weapon that the rest of us don't have, and that is that they get their school superintendents to call off school for the day, and then they commandeer the school buses. So they have a way to get lots of folks piled in and going to Frankfort. I would like to think that we would have 10,000 mental health professionals or healthcare advocates, people that are advocating for safe housing, people that are advocating for good education for our kids. Think about what you would like to have 10,000 of your fellow Kentuckians in line in front of the Capitol for. Next one, please, Angela. So I'm going to remind you of something that you already know, but we so often forget, and that is that a democracy requires that the voice of the people be heard. So we cannot have a democracy without people being engaged. This particular picture is taken of one of our Advocacy Action Network groups. This is the 874K Coalition, Disabilities Coalition. So there are 874,000 Kentuckians who have a disability of one kind or another. And that includes physical disabilities, sensory, developmental, and intellectual, mental illness, substance use disorders, acquired brain injuries, and so forth. So think about that. Think what a voting block that would be, 874,000 Kentuckians. And so we started this coalition. We've been having an annual gathering of folks with disabilities for the past 20 years. We just celebrated our 20th anniversary this year. And we bring 600 to 700 folks to Frankfort. And my job is to help people to realize that they have a voice, that even though they've been told for maybe most of their lives that they're disabled and they're in a different category, they have every right to speak up and to be one of those persons that expresses themselves in terms of changing policy in Frankfort. Next slide, please. So this is a little bit of a therapy slide. Policies are made at all levels, and they're going to happen whether you're there or not. So if you're coming to see me as a psychologist and you keep telling me over and over again about an issue that is happening to you, and I keep hearing this week after week after week, probably at some point I'm going to say to you, you know, you really have a choice. You can decide to stay in that situation, or you can decide to do something about it. And in many ways, that's where we are with our democracy. Policies are going to be made. They're going to be made in Washington, as we know. They're going to be made in Frankfurt. They're going to be made by your local city council. They're going to be made by your board of health. And all of those policies are going to affect you and your loved ones and the people that you try to care for and advocate for. So you really have a decision to make, I think, and that is to stay on the sidelines and complain about it, which is what many of us do and all of us do at some point in time, or you can choose to do something to influence the system. And I hope through the course of this webinar and in our interaction with your questions in the chat box and the things that you're wondering about, if I can help you to see the way that you can influence the system. Next. So this is a little bit of a guilt slide, I guess. Why should it be me? Because the policymakers are elected by you, and therefore they're elected to serve you. I'm going to encourage you throughout the course of this webinar to reach out and to contact your policymakers. Again, whether that's your local little city council, whether that's your larger metro council, whether it's your legislators in Frankfurt or in DC. They are elected to serve you, and you have every right to speak with them, to let them know what you need, what you're passionate about. And, you know, we cannot have them serve us if we can't tell them what it is that we want them to do. So we cannot hold them accountable unless we've told them that. I hear people all the time that complain, Frankfurt's not doing this, or Washington's not doing whatever. And, you know, my response is to say, have you written them? Have you called them? Have you met with them at a town hall meeting? Have you talked with their staff? Do they know that that's an important issue for you? Do they know that that's an important issue for your constituency, for those people that you work with and that you advocate for? So again, your role is to make sure that you're clear about what it is that you need, and most importantly, that you've communicated that in some way to those policymakers so that they know what it is that you're asking them to do. Next, please. So this is the old, you know, if you don't speak out, who will? This picture is of one of our 874K gatherings where we had probably 1,000 people with disabilities in the old Frankfurt Convention Center. It doesn't exist anymore, but we would have huge gatherings there and invite the legislators, the governor, and the executive branch cabinet people to come over and listen to our stories, to listen to people saying, here's what I've been able to do, but here's what I could do more of if I had this service, or if I didn't have this barrier to get this kind of service. So we had David Allgood, who many of you know is confined to a wheelchair after a diving accident in his teen years. And he's such an effective advocate in Frankfurt. He's up there, he's visible, and he will tell you the story that there's such a backlog of service providers for people with significant disabilities that to get someone who could come to their home every day, to get them out of bed, to get them dressed, to get them in their wheelchair and so forth so that they can go to school, go to work. David has a master's degree, but he couldn't have gotten that had he not had that personal care attendant. And in some communities, there's as much as a 10-year wait for personal care attendants. So think about the huge barrier that that presents. And if people like David and people that care about folks with disabilities like that are not speaking up, legislators aren't going to know, or if they do know, they're not going to figure it's a big enough problem that they need to do something about. So again, it really is absolutely dependent on our voices to let them know that. Next. So I think that it's hard sometimes for people to decide that that voice should be theirs. I think there's a kind of a natural, people aren't going to want to hear from me. They're important, I'm not. They're in power and I'm not. what you have going for you are a couple of things. One is that you care and you care passionately. So throughout this, I'm going to talk to you in terms of advocacy being driven by passion. In fact, later on, I'm going to define advocacy as education with passion. So I can't make you be passionate about anything, but you will decide and you will know those things that you're passionate about. And that fire in your belly is what will drive you to keep on keeping on, to keep on raising your voice and speaking out. Secondly, you're knowledgeable about your issues, particularly if you are a consumer of services, particularly if you are a family member or an intimate caregiver of someone who is getting services or needing services. You know what your situation is. And one of the most effective advocacy tools, and we'll talk about this at more length later on, is what we call putting a face on the problem. Letting the legislator or the policymaker know that this is what's happening in everyday life, day after day after day, when these services are not available, or when the funding is not there, or when there are roadblocks or barriers to getting the services that are needed. So you care and you care passionately, you're knowledgeable about your issues, and you're willing to share that with other decision makers and citizens. When we did our mental health parity legislation, which went after the insurers about the systemic discrimination that they had against mental health coverage and substance use disorder coverage, I was in a coalition with a wide range of people, including the faith community, including small business owners, including many civic organizations. And I started talking about the problem of mental health and substance use being treated differently by insurers than a heart condition or cancer. And most of the people in that large coalition had no idea. They had not had someone in their family or themselves who had a diagnosis of a mental illness or substance use disorder. So they didn't know that there were absolute strict limitations on how many days they could be in the hospital, or how many outpatient therapy services they could get, or that they had to pay a higher copay, that their lifetime limits were lower, and those kinds of things. So part of what you do in your advocacy is that you're educating not only the target, which is usually the policymaker, but other people to swell your voice. And we will talk later about the importance of coalitions. I love it that Emily calls me the godmother of advocacy and coalitions. You know, my motto is there's not a tent big enough to put everybody under it who ought to be sharing these same concerns about access to health and healthcare and services. Let's go on to the next one. So again, advocacy is education with passion. You have to be a good listener. And I learn something every day in terms of emails that I get, in terms of meetings that I go to. Well, now we're going to meetings on Zoom and conference calls, but still, every time I hear from a consumer, from a family member, from a healthcare provider who says, did you know that we can't get this service? We can't get this, we can't get the insurers to pay for this service. Or there's a disconnect at the cabinet level in terms of who can get on Medicaid right now, or whatever the issue is. So really important to be kind of all ears as an advocate. Don't be so narrowly tunneled, if you will, that you're not listening to those other pieces, because all of this is linked. You know, I started out being very narrow about, I only care as a psychologist and actually as a child psychologist about mental health services, mostly for children. And in the course of my years of doing this, I've gotten into knowing a heck of a lot about insurance coverage, knowing a heck of a lot about general health care coverage, because healthcare and mental health are inextricably linked, knowing a heck of a lot about education and poverty, and now what we're calling the social determinants of health, which are those underlying factors that keep people unhealthy, that cut off services and access to services, about the difference in rural Kentucky and in urban Kentucky. But within urban centers, the difference in, for instance, between West Louisville and the rest of Louisville. So we know that there are studies out there that your zip code determines how long your lifespan is. We need to be paying attention to that, whether your interest is narrowly around mental health or around a particular disability. We need to know how those factors play in. Obviously, an advocate has to be willing to speak up, and that's hard. I've worked with any number of people and encouraged them to come to Frankfurt to speak up, and it's scary. We had a hearing on a regulation that was going to affect services for people with severe mental illness, and we had a number of consumers and family members that came. I helped them write what little speech they wanted to give. People were nervous about it, I understand that, but afterwards, they were coming up to me and saying, when can I do this again? You know, the amount of empowerment that comes from speaking up, from speaking from the heart, from speaking from your own experiences or your own passion as a caregiver or as a provider or as an educator is what really gets you to speak. And obviously you have to be active. If you're not, you will get lost in the myriad of paperwork and bills and issues and so forth. So then in any given legislative session, I think in this last 60-day session, even though it was only about a 56-day session because of the pandemic, there were probably 1,000 pieces of legislation and resolutions, and legislators are up there without any staff. So things get lost, and you have to be willing to be active. You have to be willing to be a little bit politely in their face to remind them of your important issue and why it needs to get attention. And obviously you have passion not only about the issue, but also about how it affects the people that you're working with.
Sheila, we have a question.
Okay.
Tina Jackson would like you to speak to the problem of accessibility at the Capitol building.
That's a great question, Tina. I don't mean to laugh, but we have worked on this, you know, for the last 20 years and probably before then. So the Capitol and the Capitol Annex are exempt from most of the ADA requirements because they're historic buildings. And, you know, usually at this point, I'll say to the audience, how many of you have ever been to the Capitol and the Capitol Annex? And people will raise their hand, and hopefully it's a good number of you. So you know how inaccessible it is, how difficult it is literally to get into the building, how difficult it is and almost impossible for persons in a wheelchair or with extreme mobility problems to get into and out of the bathrooms, how long it takes to get from the annex over to the Capitol. There is a lift that is broken most of the time. And we have done everything from getting the newspaper coverage there as one of our advocates gets in the lift and it doesn't work and they're interviewed by the paper and we get it on television. We call legislators over to stand there to be embarrassed about it. Most of the time when we have our big rallies in Frankfurt, we actually engage the use of vans to meet people at the back of the annex and drive them around to the Capitol so they can go up the ramp and get into the Capitol. And I don't see any solutions anytime soon. I think we need to continue to raise that issue, but it certainly limits the ability of people with mobility issues. And actually, people are unable to get into the gallery. So if you have wanted to observe the House and Senate, it used to be that there was absolutely no way if you were in a wheelchair because you have to go up 2 flights of stairs to get to the gallery so you can watch those. Again, David Allgood in his wheelchair and a couple of other people in wheelchairs raised such a stink about it, quite frankly, that they were given permission to be on the floor of I think it was the Senate, when the debate was going on about a bill that they were advocating for, and they were actually there. And so we know that if we ask the Speaker of the House and the Senate President for permission for people to actually get on the floor of the House and Senate. So there are workarounds to some degree, but certainly not what we need. And I don't know what the solution is, because the amount of the cost that it would take, and I don't even know how you would make some of the building with those marble floors and, you know, marble railings and so forth truly accessible. But it is an issue, Tina, that we bring up constantly. And this last time, because of you know, the security, they were going to make people have to go in individually, and each person show their ID and get checked in the middle of winter. And we did intervene with the security police and work out an easier access for people. So it can be done. Don't give up. And I'm happy to talk with you offline if you're going to be going up there with a group to give you some suggestions. But the leadership is pretty aware that we're not going to go away, and we're going to continue to ask for that accessibility. It's a great question. Next slide, Angela. So you can advocate at lots of different levels. You can advocate at the individual, community, state, or national level. And I would say for those of you who are professionals, whether you're in the healthcare field or you're in the mental health field, I think you have an obligation to be an advocate for the individuals that you're treating. There are a lot of issues that come up in the course of treatment that point out the barriers that are there, and I think we need to be educated enough to help those individuals know how to navigate those barriers to get the care that they need. Or you have to be willing, again, as the provider and advocate, to help them navigate those. I think that much of what we're going to talk about today is advocacy at the state level and with legislation and regulation. But there certainly are policies that are made at the Metro Council here in Louisville or at your city council level. There are decisions made by your local board of health, and that's an area that I really encourage you, get to know the people that are on your board of health. See what the criteria are for joining the board of health. Sometimes they're very glad to have an active volunteer be on that board, and they help set policy that's very important at your local level. We're also going to talk about, there's government action that's not legislation and not regulation that is set by the cabinets and the executive branch, and we can be advocates around that too. So we need to be clear about going from the problem to what the policy is that needs to be changed. And sometimes that takes a lot of research. You have to figure out if there's this barrier and people aren't getting what they need, what is that? And is that purely a funding issue, or is that the way the criteria are set, or is that not having the right access for people? Who has the power to change it? And again, looking at whether that's legislation, which would be set by the General Assembly, our senators and representatives, whether that's by regulation, which is set by the executive branch, so that would be in the cabinet that particular topic is connected to. Most of our work, because we're in the health field, is with the Cabinet for Health and Family Services, which is a huge cabinet and takes in not only behavioral health, public health, Medicaid, but also all of child protective services and community-based services and your SNAP program, your food stamp program, and so many policies are made over there. So really important to get to know those people and to advocate with them. Who has the power to change it? Who did they listen to? And we're going to talk about some ways so that you can be one of those people that the policymakers listen to. Next, please. So how do you act as an advocate? You're willing to get involved in advocacy. Hopefully you're attending this webinar because you have an interest or have had an interest all along. Again, you're knowledgeable about the issues and you provide accurate information. And I'm going to stop here for a second, because if I asked most of you what's your biggest fear or concern or holdback that keeps you from reaching out to a legislator, most people would say, I'm afraid that they're going to ask me something that I don't know the answer to. So I'm going to get their attention, and then I get in a meeting with them, and what if they ask me something? So obviously you want to be as prepared as possible. We're going to talk about how to develop your talking points and leave them with the legislator and so forth. But it happens all the time. It happens to me after 42 years that I'll be in a meeting feeling very prepared, and a legislator will, kind of throw me a sinker ball, and, it's something that I just simply am not prepared for. So let's say that Emily's meeting with a legislator and has all her talking points and it's going very well. And then the legislator says, well, what's the impact of this on the budget? And the first response for most of us is that kind of demand characteristic where we feel like we ought to know the answer. And so our tendency is to want to pull something out of our left ear. We're very good at that. Most of you have probably been very good at that when you were in school and on exams and so forth. And so you kind of make up something. Do not do that. In fact, that's probably the worst thing that you can do. You want to have a relationship with that legislator, and that's based on trust. So whether that legislator believes in your cause, whether they're on your side or not, you want to have a reputation with all the legislators, all the policymakers, that you provide accurate information. So I'm going to say to you, instead of it feeling like a real negative, this is absolutely a positive situation. You have an opportunity to get a second bite at the apple. So what you want to do is to say, Senator so-and-so, that is absolutely a great question, and I don't have the answer for it. It's something that our group has talked about, but we just simply don't have that information. So what I'd like to do is to do a little more research. Let me go back to our folks and let me get back to you with that information. And here's where you make the kind of catch. What's the best way for me to get back in touch with you with that information? Is there a particular email address or phone number that I might use that's easier for me to get that information to you? And very often now, the legislators are giving out their cell phone numbers. They're giving out a email address that is not the LRC, the Legislative Research Commission email address, because they get inundated with a million emails on it. Sometimes they will have somebody in their office, if they're a committee chair particularly, that's doing some work with them. Most of them don't have any staff. And they'll say, here's the person, here's her card, and so forth. And then, my gosh, be sure that you get the information and get back with them. It's really, really important that you follow through with that. The other thing you can do, if your group is working with somebody like me, who's a registered lobbyist, somebody who's up there all the time, you can say, our group works with Sheila Schuster. Is it all right if she gets back with you about that information? Most of them know me because I've been around so long. I'm usually in red, which is our mental health color. And they say, fine. So you come to me and say, Senator so-and-so has this question, and, I'm his constituent, and can you get back with him? That's great for me. I may already know Senator so-and-so, but this gives me another connection with that senator, because you as a constituent are the most important people to that legislator. You're the ones that can elect them. You're the ones that can re-elect them. You're the ones that can elect them to another post, another office, if that's what they want to do. So you are really important to them as a constituent, and it's really helpful to me as somebody who's up there to be able to go and say, I work with Emily Beauregard. I understand that she is your constituent and you had a question about the budget implications. Here's that information. So he starts connecting me with a constituent and with that issue, which again is really, really helpful. So embrace that situation. I think the other thing, and I think Emily put this in the chat, the most important information in a way that you bring are not the facts and figures, but your life experience, your lived experience with this issue. And they cannot doubt that. That's your truth. And that's what you have to be willing to share to really make an impact. Advocacy groups have access to what we call free media. I've never had the luxury of working for a group that ever had any money to buy media. So we have to earn our media, and we earn our media actually by having a story to tell. And so again, we're going to get back to putting a face on the problem, getting people willing to stand up and tell their story and to share their story with the media. And rallies help, neat slogans help. They kind of catch the attention of the media. If you can come at it from many different parts of the state, that captures media across the state. It's helpful to rally that grassroots support. And you do that partly by working in coalitions to really think about and think outside the box. You know that all your mental health professionals, for instance, are going to be interested in this mental health legislation. Who else is going to be interested? And when we did that work that I talked about, that parity work with the insurers, some of our most important allies were the faith community, the Council of Churches and the Catholic Conference and the Council of Jewish Women. And we had a big long list of our partners, and legislators would say, hey, I'm hearing about this from my minister. What's the story? You know, they're trying to put together, why does the minister care about whether mental health is covered by insurance? Because it's a social justice issue. It's an absolute discrimination against people who have a brain disorder that is a mental illness or substance use disorder, that they don't have access to the same kind of insurance coverage that people who have a heart condition or have cancer have. It's an absolute social justice discrimination issue. So think about who your allies can be. What about the business community? They carry a lot of weight with legislators. They have gotten behind some of the felony reform because the workforce is so limited, and they want people to be able to be out and to be workers, and they're interested in having healthy workers. I'm still working on convincing our business community that when they say healthy workers, they really mean physically healthy and mentally healthy workers. So it's all of health. And understand that it's about policy and not about politics. And we're going to talk about how those two sometimes collide. Next, Angela, please. So what do you need?
The time is 2:38, just FYI.
I'm sorry?
The time is 2:38, just FYI.
Okay. Got to talk faster. Understand the process of the policy making. So remember, we're going to go through this a little bit. You know, a piece of legislation has to pass both chambers. So you got to work both the House and the Senate, those kinds of things. Identify your policymakers. You may have short and long-term goals. You may have a huge goal that you want to reach. I'm working with the Kentucky Nurses Association. We want to put a school nurse in every school every day. Well, you know, we're wise enough to know that we're not going to bite that apple all at once. So we're looking at ways to be able to get our foot in the door and to start working on short-term goals to get to our long-term goal. Know the time frame. We're going to be going into a short session in January, a 30-day session. And we have to do a budget there, which has never happened before in a one-year session. So it's going to be tight. It's going to be frantic. And you've got to be prepared for that. Remember to engage others in the fight. Some of our best work, I think Emily would agree, is defense. So we don't pass anything at the end of the session, but we have killed off a bunch of bad bills that would really be bad for people, that would really hurt people. And sometimes our best work is done in killing off those bills, sometimes quietly behind the scenes, and sometimes very publicly. And it's hard when you do it publicly because you run the risk of offending policymakers, and they have long memories and so forth. So you try to do it in a not personal way, because remember, it really is all about relationships. You can actually disagree with the legislator and turn around and work with them that same session on another issue. You can absolutely have a legislator who says to you, I can't get with you on your bill. I don't believe in it. I'm going to vote against it, and so forth. If you blow up when that happens to you, you have lost a possible ally, because there will be other issues where you will need that legislator and he or she may be with you. So it really is about the long-term relationships. Next, Angela. So most important, I am your constituent and I vote. And I very often say to people, if you are introducing yourself for your first time to your House member, your Senate member, send an email, and you can send it to their LRC website, which is on the web page, and put in the subject line, I am your constituent. And then you open with, I live in your district, I live at, and give them your home address, and here's why I need to talk with you, and a couple of sentences about your topic. Do not send that to all 138 legislators, because you will lose a lot of credibility. You are only the constituent of one or two. However, you can also make connections with legislators for whom you are not a constituent. You work at a hospital, and the hospital is in a different district than where you live. And you're talking to legislators, and you know that that hospital attracts patients from the surrounding 10 counties. It is very appropriate for you to say to legislators, I'm at so-and-so hospital. I know that we work with your constituents. I'm a staff member at so-and-so. I'm a member of this group, and we have many constituents of yours who are part of our group, or we do work in your district. The Legislative Research Commission has an updated website, and I've got those references for you later. So you can put your county in and get your legislators. You can also put your address in, and a little box will come up with a little pointer and will tell you who your legislators are. So how do you make connections and then stay in touch with them? Ask them, what's the best way for us to stay in touch? Do you use Facebook? So many of them use social media now. And be sure that you have your card and your information ready. And remember that this is not a one-time deal. Think of it as doing business with somebody like you would in any other part of your business. Next. So how do you make your case? We used to do policy briefs that were beautifully laid out with research. They were 10 or 12 pages, and we would do them through Kentucky Voices for Health. We would send them to legislators and so forth. Hardly anyone does that anymore. So I'm going to tell you the best way is to do a single piece of paper, lots of white spaces, lots of bullet points, or not lots, but use bullet points. Some very simple illustrations. If you can afford to use a little color to capture their attention with something, I think that's helpful. Do it at a 6th grade reading level. I am not saying that legislators are stupid or uneducated. I am saying that they have so much to read, so much to take in. They are not going to take a lot of time if they have to look up a lot of definitions of words and you're using technical information. We use scripts. In other words, we send out our action alerts and we say, call the message line. Here's who you should ask for the message to go to. Here's what you should say, 2 sentences at the most. Your talking points can be good as what we call leave behinds. Make sure that you have your contact information on them. I cannot tell you how often I go to a legislator's office late in the day. They're kind of cleaning up, straightening their desk, and they pick up something and they say, I remember this discussion, but there's no contact information on it. You know, you have just wasted a beautiful piece of talking points and so forth. Be sure your name, your organization, at least your email address is on that. So that's how to get your issues across. Next, Angela. So coalition building is really reaching out, and again, it can be formal. We have a mental health coalition that's 38 years old, 80 organizations, has bylaws, has dues, those kinds of things. We have any number of informal coalitions that kind of bubble up during the course of a session where you're kind of looking around to see who else might jump on that. We have coalitions like the Thrive Kentucky Coalition, where partners have worked together for a number of sessions, and our focus may change over the years. So, you know, we're at social determinants of health and what we're calling the community safety net. It used to be on getting Medicaid expanded, and then it was on getting everybody signed up for Medicaid, and then it was on protecting Medicaid. So you can shift with those same groups of partners. Focus on the decision makers, create a buzz. You know, if you've got somebody in your group that's good at tweeting, all the legislators now are on Twitter, doing a Facebook page to get your message out. You want the media and the legislators to know that you are a group of people, no matter how small, and you can sometimes make yourself look bigger than you actually are by creating that kind of buzz. Next, Angela. So you want to get the facts. You want to educate people. Try to pull in the same direction. It's really hard because everybody is passionate and everybody has a different idea about how to go about it. And so one of your jobs is to try to come to the legislature with everybody singing out of the same hymnal, as we say. Doesn't mean that there aren't some differences sometimes, but you want to put those turf battles aside if you can. You want to make it very people-centered. You want to talk about what the impact is on people. You want to empower others to speak up. Very unusual, in my experience, to get a piece of legislation passed for the very first time in one session. So this past session, just as an example, there was a mom whose now 23-year-old daughter has battled eating disorders for 15 years, 14 years. And she contacted Senator Julie Rocky Adams, which was a great choice. Somebody in her locality, but somebody in leadership in the Senate. And they were given an opportunity to present in December before the session started. She had a psychologist who is an expert at treating eating disorders. She had herself and her daughter. She had a physician from the health aspects. And they put on in 30 minutes a great description, very people-centered, about what eating disorders do and how few services we have in Kentucky. And they were able to get that legislation passed this past session in one session to establish an eating disorders council made up of legislators and executive branch cabinet people and providers, consumers, and family members to really look at what Kentucky needs in eating disorders. It was a textbook. And this was a mom who really had no formal education. She and I met a number of times, but it was her passion and, you know, some help from their national eating disorders group, having a great bill sponsor, having an issue that was new to people, but she did such a good job of educating people. And she met one-on-one with so many legislators and got that thing passed. So it is very possible to do that. Just want to encourage you. Next, Angela. So hopefully we have, again, those 10,000 people and we're all aiming for the same target. I think we're more likely to be effective if we can do that. Next. So we want to put a face on the problem. And again, your personal stories tell it the best. Kentucky Voices for Health has a storyteller, a videographer who is looking for stories about people who are having trouble getting services that they need. And you can contact Angela and Emily to get in touch. We've used those personal stories in federal comments on the Medicaid waiver. We've put out those stories. The media, when they tell a story about a piece of legislation, they want to put a personal story out there. So if you think about it, almost every story that's been in the media in the last couple of years about a piece of legislation or an issue has focused on people that were affected by it. And we run out of people. So we're forever looking for more people who are willing to come forward. And they can't just keep going back to the same people, or else you really lose your credibility in terms of saying this is really an important issue. Little videos sometimes. You need the data, but the data just really supports the people's stories. So local constituents are the most influential, but other voices could be very influential as well. Next. Rallies, press conferences, calls to action and action alerts. So phone calls to the message line, social media, lots of Twitter, phone calling and personal visits, a color, a slogan. I think we need to be thinking about what the legislature is going to look like in the pandemic in 2021. Those of you who were following legislation in March know that they shut down, and they needed to shut down. There were LRC staff that were testing positive. The legislators were scared, and should be. And many of our legislators are in that high-risk group in terms of age and other illnesses and so forth. So we really need to think about how are we going to do our effective advocacy if we cannot be in Frankfurt during the session, because I think that's actually quite a possibility. And we're going to be looking at taking our rallies, for instance, the 874K rally. I think we're going to have to do it virtually. And believe me, we're trying to figure out what's the best way to do that. But many of the professional groups that do days at the Capitol and so forth are going to have to do them virtually. We're going to have to really think about how to translate. So those of you who have a social media presence really need to activate that and keep that going and build it before we get into session. Next, Angela. So we want to lift up the narrative. We want to say, here's the way it's been. Here's why it needs to be changed. Op-eds and letters to the editor can be effective. I think they're actually more effective in your rural communities when they come in your weekly community papers, and I would certainly use that. Very often you can get some great coverage from your local radio station. You want to use short written communications to policy makers. Remember, one page, lots of white space. Use consistent messaging so they don't have to remember whether this is the same subject or the same issue that you were bringing up before. Next one, please. Sabi, take the phone off the hook. So all politics are local, even if the focus is at the state level. And I think that's important. So you're working at a state level, but if you're the local, your legislator is going to listen to you. And so don't forget that what you bring from the local level is just hugely important. Next, Angela. So instead of teachers, we have tulips. It's a beautiful sight in Frankfurt, actually kind of soothing. I'm going to go very quickly through what you may remember from your civics lessons so that you kind of know. This is the cognitive psychologist in me. I think it's helpful if you kind of know what the process needs to be so that you can do something about it. So next slide, please. So you have a need. You know that you have to do some public policy change. One of the things you want to find out is, has anybody worked on this in the past? And you can go online and search legislation for the past, actually, way back into the 1990s by topic. So you can search bills by an index. And if you wanted to see, for instance, if anybody had done something on gun control that's called a red flag law, you can put gun control in and look at all the legislation that has been filed, gives you an idea of who's worked on it in the past. You want to be aware of the power of the politics so that you want to be strategic in picking a sponsor. Both chambers of the House and Senate of the General Assembly are controlled with a supermajority of Republicans. So a lot of people feel like it's helpful to have a primary sponsor of your legislation that is a Republican. I think that that's not a bad strategy. Helpful to have bipartisan support through your co-sponsors and maybe a primary co-sponsor who may be a Democrat. In some situations, there are Democrats who have a reputation for working very well across the aisle and may be experts in the very topic that you're taking on. So I wouldn't shy away from having a Democratic sponsor if that's the case. So you want to work on timing, co-sponsors, communicating with leadership. Next, Angela. These are the two things I try to remind myself as I'm driving to Frankfurt. I've been doing it for 42 years. So public policy and legislation is not always logical and rational. I kept thinking after the first time that I went up there that I would be able to figure out how it all worked. And there actually is a process. And if you hang around long enough, you sometimes can understand how and why some things happen. But if anybody, even a legislator, tells you that they understand everything that happens during the session or why certain things absolutely passed and why others didn't, I would be a little bit skeptical because there are just things that happened. Sometimes you're in the wrong place at the wrong time. I had a very important bill that was held up this last session because a committee chair didn't want to hear any bills except one that he wanted to get passed, and he was going to bottleneck everything else. And it had nothing to do with the content of our bill. So you have those kinds of things that come up. I've had a bill that was needed one final vote on the consent calendar, and they adjourned the House early and forgot to call the consent calendar for that final vote. So we lost a bill that had never had a no vote through the entire session, which was really hard to explain to people back home. The other is, and I love this one, those who love sausage and the law should watch neither being made. You can get good sausage just as you can get good law, but it really is a factor of what has gone into it, into the making of it. Next, Angela. So I would say to you that our issues, particularly health and welfare issues, people issues, are not partisan. In other words, the health of someone is not a Republican issue versus a Democratic issue. Democrats and Republicans may have different ideas about how to define health and how to achieve it, but the issue of health is not partisan in and of itself. The process is political. And if you don't know how the process works and how the politics play in, it's going to be very hard for you to be successful. So the first thing to remember is that the party who holds the majority holds the power. And it is an absolute power, more so if they hold the majority in the kinds of numbers that the Republicans hold the majority now. So they can essentially pass amendments to the Constitution. They're going to be able to do a budget in 2021 unless it changes without having any Democratic votes and so forth. So it's just important. They appoint the committee chairs. Majority party has the majority of the members of the committee. That doesn't mean that your minority legislators don't have a vote and a voice, and they sometimes can actually sway the majority to come over to their way of thinking. Next, please. So important to know that only a member of the General Assembly can introduce legislation. I've heard lobbyists say, well, I introduced this bill. No, you didn't. You may have worked with the legislator who introduced the bill, but only a member of the General Assembly can get it drafted. The drafting is done by the Legislative Research Commission staff. We call them the LRC staff. And actually that drafting process is confidential. So you can't go to an LRC member and say, is anybody working on mental health parity? Is anybody working on revising, the bail, the way bail is done? They can't tell you that. So you have to find that out from the legislator himself or herself. A bill can only become law if it's passed by both the House and the Senate and signed by the governor, or is at least not vetoed by him or her. And I put this last one in about bills can vary in length from only a single line to hundreds of pages as a reminder, because people will say to me, Sheila, this is going to be an easy bill to pass because it's only one sentence long. And I say to them, the process is the same. The process is the same whether it's one sentence long or whether it's 300 pages long. There might be more time needed to explain a 300-page. Sometimes those little short bills that are called simple bills are looked on with more scrutiny by legislators because they're wondering what the trick is or why it needed to be a bill and so forth. So just a reminder that everything has to go through the same process. Next, Angela. So the Kentucky General Assembly meets every year beginning in January. They start on the first Tuesday after the first Monday. So in 2021, it will be January 5th. If you remember, the Kentucky General Assembly used to meet just once every 2 years. And the joke was that we would be better off if they met once every 60 years, as opposed to for 60 days every 2 years. That was changed in 2000. So 2001 was the first odd numbered session. All the sessions are somewhat odd, but that was the first one. And we're coming up in 2021 on an odd number session, and that's 30 days long. Typically, the biennial 2-year budget is passed in this session. So when they ended the 2020 session early, and because of all the uncertainty about COVID and its impact on tax collection, they very wisely, I think, decided to pass only a 1-year budget. So this is the first time in history that we are coming into a 30-day session where they also have to do a budget. And the budget typically sucks up all the air in the session and is the overriding, because if you think of it, the budget is actually the policy statement of the Commonwealth. What are its priorities? What is it going to put most of its money toward, and so forth. So it will be a very, as I said earlier, a very hectic session. It'll be very difficult to get new issues introduced for the first time and passed. So you're really going to have to do your homework going into the session. And then occasionally the governor could call a special session to deal with one specific issue. And I don't think, we thought at first we were going to have a special session on fixing a deficit in the budget, but it looks now like we're not going to have a special session before January. Next, Angela. So bills can only be introduced when we're in session. They can be pre-filed and they'll be posted and they'll have a BR number, a bill request number, but they're not considered introduced and filed until they are in session. So that first 4 days that they're in session, from the 5th through the 8th, you will see a ton of bills introduced. The House bills will have an HB number. That means that your primary sponsor is a House of Representatives member. The Senate bills will have an SB number. Your primary sponsor is a senator. That bill number stays with that bill no matter what. And that's something that people have a hard time with. So we'll send out an alert and say our bill that we're all working on is House Bill 123. It passes the House and gets over to the Senate. And we're sending out an alert and say, please contact the Senate Health and Welfare Committee to have them favorably pass House Bill 123. And I will inevitably get emails from people saying, don't you mean Senate Bill 123? Well, no, Senate Bill 123 may be about pig farming because there already is a Senate Bill 123. So your bill number stays, and the importance of that is that when you call the message line, you can't just say, please vote for the health bill, because there may be 50 bills that are in that health category in the index. Really important that you remember your bill number and talk about it. And legislators will ask you that. they'll say, has the bill been filed? Where is it? Meaning, has it passed the House? Is it over here in the Senate and vice versa? Do I have to worry about it yet? So if you have a House bill and it's still in the House and you're talking to a senator, they probably are not going to pay a lot of attention to you until that bill gets out of the House. And then you can say to them, remember that bill I was telling you about? Now you all have it over in the Senate. I'd like for you to pay attention to it. House Bill 123. So the majority party determines what committee the bill goes to and sometimes decides whether it gets heard or not. Most bills don't pass not because they were ever voted down. They don't pass because they were never heard. They were never acted on. So you can go on the website and look at any number of bills that were introduced and sent to a committee and nothing ever happened. That's why you have to be active. You have to have a sponsor that is committed to really getting some action. Talk to your committee chair and members before your bill gets there. So the first time I ever went to Frankfurt as a volunteer with the Mental Health Association, 1978, they said, we have a little bill about insurance. Would you go and talk to the committee? I'd never been to Frankfurt. I'd only lived in Kentucky for 8 years at that point, I guess. So I did all of this research and I drove up there, finally found my way to the committee room. And I was expecting that I was going to be testifying against what I call the blue suits, you know, the high paid CEOs at Anthem and Humana and United and so forth. And instead, it was very informal. There were senators sitting over there with nameplates in front of them. And then there were a lot of people milling around and talking to them. Lots of people knew each other. I didn't know anybody. So when the time came for our bill, they told me to come up to the table and I introduced myself. And I'm sure I gave outstanding testimony. I don't even remember, but I, did my best. There were no questions. And then they asked for the con side. Mine was the pro in favor of this health insurance offering for mental health. And these guys came up who were auto mechanics and farm dealer parts, businessmen and farmers. And they were dressed like in their work clothes and so forth. They knew the committee members and they called them by their first names. And each one of them told the same story. And the story they told was, don't vote for this bill. My insurance agent has told me that if you vote for this, my insurance premiums will go up by $1 bazillion and I won't be able to buy insurance. Or don't vote for this bill because my insurance agent has told me that if it passes, I can't afford to provide insurance for my workers. So I have repressed, which is a psychological defense mechanism, the vote on that bill, but I don't think we got even a single yes vote. And I walked out of Frankfurt and got in my car. So this is 1978. And I guess I could have said, well, I'm never coming back here again. Instead, I was just fascinated. I was trying to figure out what the heck happened. What was that? And so one of the lessons that I learned is about relationships. The insurers were a heck of a lot smarter than the Mental Health Association. And so they knew everybody who was on that committee. They went to their constituents from their part of Kentucky, got somebody who knew that senator and had them come and testify and tell their story. They didn't have any data. I had tons of data. I had all these figures about how people need mental health and what happens if they don't get it, all of which was accurate. They also had talked to the committee chair and the members beforehand so that they weren't relying just on their testimony. And of course, I had not made any contacts. I didn't know to do that. And I just got fascinated with it. And I've been going back to Frankfurt every year since then. So and I'm still learning. So don't be discouraged if all of this sounds a little bit like Greek to you. It is a learning experience every day that you are there. But I will tell you that it has to do with your passion and your advocacy, staying the course, and your willingness to reach out and get to be known and to know those people that have the power. So you want to communicate with the committee before your bill is heard. You want to communicate with the leadership about having the bill heard on the floor of the House. You want to prepare your sponsor for questions. I've sat up in the gallery knowing that there was a bad amendment out there, and I've worked with the sponsor to beat back the bad amendment. And I always want to have one of those tin cans with the wire that we used to have as kids, you know, where you could whisper in their ear and say, no, that's, you know, here's what you need to say to counter that argument, you know, that kind of thing. So next one, please, Angela.
And the time is 3:10.
Okay. So the Schuster rule is celebrate everything positive that happens to your bill. You get to the right committee, you get out of committee, you pass the House, you know, you celebrate like crazy. You got to do the whole thing again over in the other chamber. So you got to get to the right committee, you got to work with that committee, you got to get heard, you got to get out, and then you've got to be sure that your bill does not get vetoed. And we had a bill called Tim's Law. I think Brenda Huntsman just put something in the chat about it. Worked 5 years. We were in our 5th year. We finally got the bill passed. I think we had 1 dissenting vote in the Senate the whole time. We were ready to celebrate. In fact, we were working with the governor's office to have a big celebration. And Senator Julie Rocky Adams texted me and said the governor has just vetoed our bill. And I felt like I'd been hit up the side of the head with a 2x4. My concern was that the governor was going to be there and was going to continue to veto this in the ensuing sessions. And then she texted me later and said, we're going to fight it. We generated probably 1,000 calls to the message line. We had everybody that we could round up in red the day they came back. We had Tim's mother and sister standing on the landing outside the Senate chamber, meeting every senator as they came in, saying, this is Tim's mother and sister. They can tell you the hell that they've been through and why we need this legislation. And the Senate overrode, and when they did, then the House overrode that veto. So we had one hell of a celebration that year, and we did not invite the governor to our celebration. Thank everybody who's helped you along the way. Next, Angela. So we passed the bill. We're celebrating. We used to think our job is done, and now we know it's just really beginning, because the next thing is that the executive branch now has to do its job, which is the regulations. So that's crossing the T's and dotting the I's. Next slide. So if you've ever framed a house, you kind of know what it's going to look like, but you absolutely cannot live in it. And that's what legislation does. That's what your statute looks like when you come out with your statute. Next slide, Angela. So you have a whole regulatory process, and a lot of people don't pay attention to it, but that's as you talk into the executive branch. And you've got to be sure that your bill is going to be put into place in the way that you want it to be put into place. So you can be an advocate on the regulation side with the executive branch, just like you were with the legislators. And you can communicate, you can give your testimony, you can send in your written communications. And if we think we're in trouble on a reg, we will send out an action alert and say, you don't have to come to Frankfurt, but here's an email address, send in your comments, and they have to reply to every comment that comes in. So it really is important to keep an eye on that. And there again, you want to be working with your executive branch, with your cabinet people, and explaining to them why it needs to be a certain way, because you know more about that statute at that point than they do. And their job is to put, you know, again, filling it in. Next slide, Angela. So that's our lovely house. You know, we've taken our statute and we filled in all the regs. So we now have plumbing and electricity and flooring and wonderful choice of colors and so forth. And so you hope that it stays that way. You know, things change. We had to come back and tweak Tim's Law 5 years later. We still have not had funding until now. We just got a big SAMHSA grant to put it in place in the western half of the state. So it takes time. You know, you can't just pass the bill and then walk away. You really have to hang in there with it. Next slide, please. So the question comes up, are we advocating or are we lobbying? So I would say to you that all lobbying is advocacy, but not all advocacy is lobbying. Kentucky, because of some very unfortunate violations of the law that happened back in the 80s, has a very strict requirement for registering as a lobbyist with the Legislative Ethics Commission. And the major distinction is if you are paid to interact with legislators in attempt to influence them to vote for or against legislation, you are a lobbyist. So I am a lobbyist because I work for organizations that pay me to go to Frankfurt with that in mind. 99% of you, probably maybe 100% of you in this webinar are not lobbyists. You are doing this out of passion as advocates. So you are citizen advocates, not lobbyists. Sometimes the staff of agencies who are supported by federal funding, like some of the health departments, get federal grants, and they are specifically prohibited from doing any lobbying around specific legislation, and they may have a lobbyist that works with them. There's a wonderful organization out of DC called the Alliance for Justice. They are available, they do webinars, they have people on staff, and that is their website. And I really encourage you to be in touch with them with your questions. Also the Ethics Commission, the Legislative Ethics Commission is really wonderful about answering your questions. So if you have any question about that, you can go on the website and find them and call them. And they have great people over there. They have an executive director. They have some attorneys. And don't be afraid to do that. If you really are struggling or your organization's struggling about whether you need to register or not, do it. Next, please. So what about your voice in Frankfurt? You need to identify your senator and representative. Go to the new website, the LRC website, and again, type in your home address. Remember, your district is by your home address. This funny little arrow will come down. You click on the arrow and the picture of your senator and representative will come up. And those LRC website pages give you all kinds of information. They give you background on them in terms of education, profession, civic organizations they belong to, religion, what committees they're on, whether they're chair of committees, how long they've been in the legislature. One thing I would suggest is that some of them have not changed or updated their photo, and they've been in the legislature for 20 or 30 or 40 years. So it may be hard to recognize them when you actually see them in Frankfurt. Contact them at home. It is absolutely your right as a constituent to contact them back home. Do not call them at midnight. Do not tell them that Dr. Schuster said you should call MAD at 3 in the morning or anything else, but they are used to being contacted. You also can call the message line. I have that down there during the session, 1-800-372-7181. Every call to that message line generates what they call a green slip that is in their office. So if you go to their offices, you will see these piles of green slips, and they sometimes will sort them by those that come from constituents. Yours are at the top of the pile. They will also sort them by legislation that seems to be more active than others. I've had legislators come up to me and say, hey, this is, your issue is really a hot issue. And I'm hearing from a lot of people. And I will say, well, how many people have you heard from? Oh, I bet I've gotten 6 or 7 or 8 calls. So think about this, folks. Every House member represents 40,000 Kentuckians, most of whom are not active. So if we have an issue and they hear from either by phone, or we used to have postcard campaigns, they hear from constituents that number 6, 7, 8, 10, 12, that is a hot issue for them, particularly if it's an election year. So do not underestimate the power of your voice, again, as a constituent. And I'm going to stop here and tell you my favorite story. So when we were doing our mental health parity legislation in 2000, this was the original David versus Goliath. So it was a little band of mental health advocates, NAMI folks, and mental health professionals and so forth. who were going up against the insurers for this systemic discrimination. And right before the session started, I went to a workshop, and one of the speakers was a consumer of mental health services. And she told a story that was just what we needed. I mean, it was, I tell people I always felt like somebody was tapping me on the shoulder from, central casting saying, Molly's your person. So her name was Molly Klaus, and she had been a teacher in Jefferson County Public Schools on her way to becoming a principal, and had on 3 different occasions been in the hospital, unfortunately misdiagnosed the first time, but put out of the hospital all 3 times because her state employees' health insurance said there was a limitation of 5 days inpatient, regardless of the diagnosis, regardless of what the doctor said. And she ended up not getting the treatment that she needed. She ended up losing her job, almost losing her family, and ended up on disability. And when I met her, she had been working with Virginia Mental Health Services in Louisville, and was well into a recovery program. And part of her recovery was telling her story. We had never had a consumer come to Frankfurt and tell their story before. So she became the face of our mental health parity. And I'm not exaggerating when I say that when she testified and told that story in the most incredible way that she did, that you could have heard a pin drop in that room. And that doesn't happen very often in Frankfurt, with people, coming and going and not paying attention and so forth. And so we had this incredible kickoff from Molly, and we got out of the House and we got over to the Senate. And 2000 was the first year that the Republican legislators had the control of the Senate, and they had said, we're not going to pass this bill. And the bill was assigned to a committee headed by Senator Julie Denton from Louisville, and we were persistent. We were up there in red. We had a big bus parked between the Capitol and the Annex that had a huge sign that said, HB 268, do not discriminate. And we were just barraging legislators. And she finally said to me, if you've got the votes in my committee, I will give you a hearing on the last day of our committee hearing. And I said, I've got the votes, and here they are, and so forth. So the day came, and unfortunately, 2 of our yes votes were testifying in other committees, so they were not available. And Julie kept moving us to the back of the agenda to give us time. And finally, time had run out, and she had to call our bill. And I thought, well, we're short, because our 2 votes are not there. And I looked out in the audience, and I saw a gentleman who had come up from Central Kentucky and was a farmer, was still in his farm clothes, and had a son with a serious mental illness. And I knew he was a constituent of a senator that I was pretty sure was a no vote. And I went over to him and I said, Chet, you need to come to the table and tell them that you have a son and this would help your son. And he said, no, I can't do that. And I said, yeah, you really do have to do that. And I convinced him to do it. And I felt so badly as a psychologist, because he was literally sitting at that table and his hands were shaking. He was so nervous about being there, and I had scribbled out something, and he was looking down and he said, my name is Pat and I'm from so-and-so, and I have a son with a mental illness, and this bill would help him. And then he looked up and he looked right at his senator, and he pointed to his senator and he said, and Senator, if you want your yard sign in my yard again, you'll vote for this bill. Well, of course, everybody in the room just burst out laughing because everybody was so surprised. And some of the lobbyists were saying, oh, Sheila, that was brilliant. And I said, that was not me. That was this man's passion about his son and about the importance of this legislation. So when they did the roll call, they got to that senator and he said, I want to explain my vote. And my heart sank, because usually legislators don't explain their vote unless they're voting no, and they want to give you some rationale. And I thought, I can't believe he's going to vote no and we're going to lose this vote. And he looked out and he looked at Chet in the audience and he said, I was going to vote no on this because, I didn't understand it. But Chet, this vote's for you. I vote yes. And we passed that committee by that one vote. And we went on to be heard in the Senate, even though they were opposed to the bill, and partly because Molly had been in touch with Senator Dan Kelly, the majority floor leader, and had told her story to him. And finally emailed him and said, I thought that a democracy was the voice of the people. You've heard from the people. Where is the democracy? And he convinced President Williams to let him call that bill. And if you look at House Bill 268 in the 2000 General Assembly, it will say that it passed unanimously. And that was because President Williams wanted everybody then to be on board so that nobody could be held accountable for not voting for it. So the voice of one person is just so powerful. And I just encourage you to use your passion and to come forward with it as an advocate. Next, Angela. So you vote and you speak out, and you can influence others to vote and to speak out. Next. So 2020 is an important election year. This is the other way you could be an advocate. 65 out of 100 Kentucky seats, House seats, and 12 of the 19 are on the November 3rd election. You can go to the Secretary of State website to see the candidate filings. We'll be posting them on Advocacy Action Network. Get involved. This is the other way you can be an advocate. You know, these House and Senate elections are so local, particularly the House. Again, 40,000 constituents. If you're willing to walk a district with a candidate to distribute information, to, and these days have a virtual Zoom meeting to introduce a candidate to your colleagues and friends, that legislator or that candidate will never forget your help. So you can do all kinds of things. Obviously, they're expensive. If you are so inclined to donate to them to help them defray the expense of their elections, or donate to a PAC of a group that you're working with. You know, money is not dirty in politics. It can be, but in terms of helping legislators and candidates have the wherewithal to get their message out. But be sure you get registered and be sure to vote. That's the other way to really be an advocate. Next. Stay informed and connected. Most of what's happening right now, you're going to have to watch on KET because we're not allowed into the buildings to watch the committee meetings. Kentucky Voices for Health will follow legislation, as will Advocacy Action Network and other Thrive Kentucky partners. Be persistent. That doesn't mean you have to be aggressive, but be the Energizer Bunny. I've had legislators say to me, you know, I don't pay attention to an issue the first or second year I hear it, but by the third year, I think they're really serious about it. So think about that. You know, when they've got 1,000 pieces of legislation, they got to have some way of kind of sifting through, and that's one way. Remind yourself to say thank you. We have a part-time, mostly volunteer legislature. Nobody is getting rich up there. They're giving up their earning potential while they're there. Most of them, they're giving up time with family, and really helpful. A thank you note, handwritten thank you note, which has been kind of my trademark for years, is very much appreciated. Reach out and educate others who can help, and believe that your voice can really make a difference. You know what? It really can. So I'm going to leave you with my favorite quote, which is the Margaret Mead quote. And I'm sure if I were here in person with you and seeing your passionate faces about advocacy, I would be saying to you, I think you're that group of thoughtful people that change the world. And indeed, that's all that ever has. I'm so glad to have had this chance to be with you today. Angela is going to follow up with you in terms of getting the certificate for continuing education if you're a social worker or a community health worker. She also will be sending out to you the slides that we used today and some additional advocacy pieces that I have about some do's and don'ts in meeting with policymakers, some ways of contacting your legislators in Frankfurt, in session and outside of session. And you have my email address. I think we have a final slide that's got that on there. Yeah. Feel free to email me. Do we have any lingering questions, Angela?
I do not have any in the chat.
Well,
You're a treasure. That's what the chat says.
and did I finish on the dot or what?
You did, on the dot.
I always laugh because I never am quite sure how to do Angela was good about kind of cueing me about time. So I really miss seeing you all in person. I get energy from hearing the questions in person and seeing people, but we've got to learn to work virtually, and we absolutely have to learn to be in touch with our legislators virtually. So as we learn little tips as we go along with people like Angela, who are so good on social media, Marcy Timmerman is wonderful. She does a lot of social media for me. We're going to pass those along because we have got to figure out how to stay in touch, how to make contact, and then how to stay in touch with our legislators virtually. So thank you all very much, and thanks to Thrive Kentucky, to Emily and Angela for helping me do this today.
Thank you. Have a wonderful rest of the day, everyone.
Have a great day. Bye-bye.